I've never seen anything like this. It's crazy looking. Why does it have this rolled border and this redness in the center? Like, is this exposed? This is really concerning to me, and it really makes me think that this could be something much more dangerous.
My name's Leonard. I'm 54 and I have a large bump on my shoulder. I call it the chip on my shoulder.
Wow, that is a big open wound that he has on his shoulder on a huge mass. It almost looks like a second appendage. Definitely we need to hear a little more about this story.
It started as a small lump, and then it got bigger and bigger to what we have here today. Between a few years ago and now, it went from an egg to a, can I say booby?
This is very, very bizarre. The fact that this has grown over this many years gives me hope that this isn't something super serious. But this is bizarre, and the fact that he has that open wound on the end of it is really, really concerning. It's not uncommon that a non-healing wound is associated with cancer.
It weighs, I believe, 3 pounds. I scratched it on a man-eating briar one day at work, and it kind of teared a little bit. Now it's still trying to get out by itself.
Oh! There are a lot of thoughts in my mind going on of what this thing could be. The first thing is worrying about cancer. Second thing is, if it's not cancer, is it possible that it's just a bizarre lipoma? The weird thing is lipomas don't typically grow in this manner. They typically grow under the skin and they become more of a lump under the skin versus this almost like an appendage growing out of him. So this is definitely something where a biopsy will be needed to figure out exactly what the heck is going on here.
It smells bad all the time. It started smelling like rotten deer head, and now it smells like 10 dead rats.
When he says it smells like that, the first thing I think about is dead tissue, necrotic tissue, like gangrene.
What are you worried about? Seriously.
It's just still in my head. I gotta be at that damn doctor's office. I know there's been sick people. The thing is all enclosed. I'll feel safer cutting it off with the chainsaw than going to the damn...
That ain't gonna happen.
He has got some significant psychological issues if he would rather cut that thing off with a chainsaw than see a dermatologist to take a look at it. Now, there are valid reasons why people are afraid to see a doctor, and I know that there are phobias that some people have of doctors, of people wearing white coats. But when you've got a mass like that hanging from your arm that smells like 10 dead rats, it's pretty clear what you need to do about it. You gotta see a doctor.
I am very afraid of catching plague because I'm coming to a doctor's office. I'm scared to go in there.
In addition to his fear of catching something from doctors, I do think that there's a fear some patients have of actually finding out what their problem is. There's a denial that maybe if I don't figure out, if I don't get a diagnosis of what my problem is, then maybe it will go away. It brings to mind a patient that I wrote about in my last book, Playing God, The Evolution of a Modern Surgeon. Many years ago, as a resident, I saw a patient in the hospital who literally had this wound of her breast that she had let go for so long that her breast became obliterated. And she had breast cancer that she left undisturbed for many, many years. Unfortunately, by the time she came to the hospital, it smelled like what he is explaining his arm smells like, and the cancer had progressed so much that she died a short time later.
Okay, you want to show me what you got here? That hurts?
It's, yeah, I know you're doing it, that's for sure.
Just to see if it's attached to you. I've never seen anything like this. It's crazy looking. Why does it have this rolled border and this redness in the center? Like, is this exposed? This is really concerning to me, and it really makes me think that this could be something much more dangerous.
I'm glad that Dr. Lee agrees with me that this is something that is really concerning. It's really unusual. It is not something that I have seen in my practice before either.
In many ways, it's helpful to know what it is beforehand because that can sometimes factor into your decision-making on how to remove it.
I lost 2 people from cancer. I've had these fears as long as I've had Chip. I don't want to die.
So taking a biopsy and knowing a diagnosis before you proceed with removing it is actually kind of important. But is that okay with you? That'll help us to figure this out.
With something this big, you want to get a biopsy first, see what it is, and if it comes back as cancer, you don't necessarily just go straight to removing it in an office. You want to then have him consult with an oncologist and really have the whole team of cancer specialists on board. So this is really the absolute responsible way to treat this gentleman. This episode is brought to you by my skincare line, Youn Beauty. Our products combine natural and organic ingredients with the latest in scientifically proven anti-aging components like vitamin C and retinol. So if you're looking for healthy and youthful skin without the unnecessary chemicals, this is the skincare line for you. Check them out at dryounonline.com and use the coupon code 20OFF to get $20 off your first order over $99. We'll put a link in the caption below. All right, back to the video.
This is a really complex case. Leonard came all the way out here to see me, and I know he would love me to take care of this right here and right now. But the most important thing is Leonard's well-being. He has something that looks really suspicious to me. I'm really concerned about it, and I need to check this tissue before we proceed further.
One very difficult thing about being a doctor is sometimes patients come in with an agenda of what they want to be done. For example, in my practice, I have patients who come in, they know that they want filler, or they know that they want Botox, or they know that they're a candidate for, let's say, a facelift or breast implants. And when I take a look at them, sometimes I may disagree, or I may feel that a different course would be better for them. And that puts you in sometimes a difficult position. In this situation, he wanted to get this taken care of in one fell swoop, but Dr. Lee made the right medical decision to recommend that he take this in a stepwise process.
That tissue that I took from you came back with mature adipose cells, consistent with a lipoma.
Wow.
Well, that is surprising. A lipoma creating that. I've taken off hundreds of lipomas throughout my career, and I have never seen anything to that extent. And the fact that he had that open wound on the end of the lipoma is very unusual, because typically a lipoma, even though it's abnormal growing fatty cells, it should heal fine. The skin over it should heal fine if it's been damaged. So I'm glad that this is his diagnosis, because it could have been much, much worse.
With Leonard, I use the tumescent technique of numbing, which really plumps up this area and makes it very visible and very puffy. What I'm going to try here is, instead of using a linear incision, I'm going to do a circular incision so I can remove that damaged skin there. And once I pull whatever's inside there out, I can really use this normal skin to create a nice little closure.
Oh my gosh, you look at that, and the thing that comes to mind to me are movies where you've got aliens in these like pods or eggs, and it opens up and the alien sticks his head out in the middle, and it almost looks like it's doing that. So what Dr. Lee is planning to do is definitely the way that I would recommend. You can't just lop that off from the base of it, because if you do, you won't have enough skin to bring back together. So you've got to use the skin that is already there to close up the defect that is created when that mass is removed. So it looks like what she's going to do is kind of akin to like coring out an apple, or if you have, let's say, a kiwi and you cut the top and you try to remove all of it from the inside, that leaves you that outer shell to close things back up so you don't have an open wound afterwards.
Make sure I'm never hurting you, okay? That nothing's ever sharp or uncomfortable. I'm gonna use my finger to move around here, and that's because that's very safe. It's blunt dissection. Look, here's your lipoma coming out. You know, Chip's pretty cute.
Of course he gets that from me. I could have done this at home.
No, you could not.
Yeah.
Right.
Now you may be watching this and saying, oh my gosh, she's taking her finger and she's using it to kind of pull everything out. That is a very valid surgical technique. We call it finger dissection. Sometimes by using your finger, you can really get a better feel of the planes, of where to pull it out. I used to work with an old school plastic surgeon where he would do a tummy tuck where you lift all the skin up off the muscles of the belly, and he would do it with his hands. He would make an incision from hip to hip, stick his hand underneath, and literally cut all of those connective tissue fibers between the fat, the skin, and the muscle by using his fingers. It was crazy.
It's like a flower. I like Chip. Chip is pretty cool.
If any other woman said that to you, I'd be like, okay, Lenny, you gotta let her go.
But I'm okay, though.
Yeah, you're okay.
Your lipoma is gone now.
Oh my God.
See how it's like these globules? These multiple lobules that were tucked in there? You saw it come out. It was like a flower.
Insurance doesn't pay you hardly anything to take these things out, but the benefit of doing that is when you pop that baby out, it just is such a satisfying feeling.
All right, I'm done. How's that look?
A hell of a lot better.
All right, you want to see your friend here, though?
Yes.
See how it's like these globules? These multiple lobules that were tucked in there? You saw it come out. It was like a flower. It's really pretty, though, isn't it?
The good news is that lipomas are completely benign. Even though they may grow and they may cause discomfort if they kind of impinge on nerves, they don't kill you, they don't metastasize into other areas. So that's the great news, because this could have been a much, much sadder story.
It's been about 6 weeks since I seen Dr. Lee, and she parted me and Chip. They said, oh, you know, you look different. You seem happier. I said, well, you know, I ain't got a chip on my shoulder anymore. I don't have that very pleasant aroma anymore. Maybe now people eat with me again. People ain't looking at me like I'm a deformity.
Glad you got your chip off.
I'm not secluded like I used to be. I'm trying to get out more often.
Well, good for him. I wish he would have done this earlier. Maybe he wouldn't have had to go through a lot of what he did. As you can see, the whole process wasn't as difficult as he thought. I think the only thing I would have done differently is maybe do this in an operating room with him asleep. That way I wouldn't have to worry about him being so nervous. But who knows, maybe he wouldn't have agreed to go to a hospital. I mean, he barely would go to a doctor's office. So for her doing this in her own OR at her office, kudos. Great job, Dr. Lee. Isn't it so satisfying to see Dr. Lee remove these big things off of people and have them look so great afterwards? Well, take a peek at this playlist right up here where I react to a number of Dr. Lee, Dr. Pimple Popper's videos. They are gross, but they are so satisfying and fun to watch. And if you've been enjoying my videos, please subscribe to my channel, and always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.